This is wonderful. It's an opportunity for us to reach out to the entire community. We have 4 support groups meeting every month with an attendance of about 100 total. And so this is an opportunity to reach to the people who aren't able to come to a support group meeting because they're working or they can't drive at night. And so Saturday afternoon for that is perfect. I personally have lived with a type 1 diabetic for 54 years, and he has all his toes, he has his eyesight, he has his kidneys. We can give these people hope that they can live a healthy life as well, but they need to learn how to do it, and that's what we teach. There's so little diabetes education out there. There are expensive classes that you can go to, but most of these people who come to us are uninsured or underinsured or just have nowhere to turn.
No, when I was pregnant with him,
that's our second baby right here.
Way more normal.
My name is Skyla, and I have been a type 2 diabetic for 5 years now. When I was diagnosed as a diabetic, I was unemployed, and my husband was unemployed, and I had no insurance and nobody to turn to get my meds. I didn't know what to do. I was very scared. Somebody gave me a number for Oregon Health Authority, and I wish I could remember her name, but basically she put me in touch with Sandra. And the first thing she did was comfort me and just tell me, it's okay. Yes, you're a diabetic, it's not a death sentence. You can still live a long, healthy, productive life even though you're a diabetic. So let's get you started on what you need.
We are a 501c3 nonprofit, and so everything we do for the people who come to us is completely free. They can come and listen to medical professionals and get their education in little snippets so they can digest it and understand and put it to practice and then come back and learn some more.
So do you know anything about diabetic shoes in your daughters?
There's such a demand for education. It's amazing that there isn't more out there because it's such a common problem. It's an absolute epidemic due to lack of exercise and obesity. Little kids are now being diagnosed with type 2 diabetes. We want diabetics to learn that they can handle this disease with a sense of humor. And so we give these people hope because we have a life story of diabetes. We can give the people hope and say, hey, we did it, you can do it.
So within 90 days, that was the kind of result that we saw. It was absolutely phenomenal, and we've seen others. My own mother.
Frequently, those who are diagnosed with diabetes encounter fear and frustration and confusion, and they find it difficulty navigating the tricky waters of modern healthcare. Diabetes Support Services really functions as a lighthouse, helping to guide them home and back safely to harbor. And we provide them with the tips, the tools, and the practical experience to regain their health and to take their power back.
Diabetes Support Services was really there for me when I needed them. I don't know if I would have gotten the help that I needed if they hadn't given it to me. They have a network of resources that they can tie people into, and they're just basically a group of people who are caring and wanting to help other people live a healthy life with their diabetes. So I guess in a nutshell, I would say that Diabetes Support Services for me is a support group of sorts.
Here in the Salem area, we meet 4 times a month, and generally in the same places, but the best thing to do is to always visit our website, because from time to time the venues do change, and you can find that at www.sugarsmart.org.
We want to help the world. We want to be out of a job. We want diabetes to be cured. That would be the best thing in the world. That's my fondest hope.